Does your loved one, whether it be a mother, father, sister, uncle, aunt, having feeding tube, and you're struggling them to maintain the nutrition? I'm Alan Bienstock, and I'm a board-certified plastic and reconstructive surgeon, and I can help you with this. I do house calls in the home. I'm not your traditional surgeon. I help people with chronic and complex wounds who are homebound and bedbound. Many of my patients do not have adequate nutrition, even if they're having feeding tube. A feeding tube is a type of tube that goes through the skin into the stomach if they're not able to swallow through their mouth. Many patients get processed liquid that goes through the feeding tube, such as Ensure or Boost, or some other high-calorie processed material. I have one patient who was getting this regimen and was having severe diarrhea and was losing weight. I made a recommendation. We switched something over to Kate Farms, which is much less processed and more organic, as well as giving them pureed food through the feeding tube that was liquefied. This patient really liked hummus, and the wife was able to liquefy it even more and was able to give it to him. And after 4 weeks, the patient's diarrhea completely ebbed and the patient was gaining weight. The wound improved significantly and he was thriving. These are things I routinely recommend for many of my patients in terms of nutrition, particularly when they have a feeding tube, is trying to stick away from the continuous feeds, meaning they're getting continuous liquid through the feeding tube. We don't eat continuously throughout the day. We have 3 to 4 or sometimes 5 meals a day. So it's better to have someone who is homebound or bedbound with a feeding tube to try to simulate that. Now, I know this may pose a risk in terms of getting pneumonia, but patients that have non-continuous feeds, meaning they're getting regular meals, whether it's liquid through the feeding tube or purified meals through the feeding tube, thrive much better in terms of their overall conditions, whether it being Parkinson's, dementia, as well as nutrition. If you have any questions or comments, you can leave them below, and I can definitely help you out. I look forward to educating you and helping you and empowering you during our next episode.